This video is about post-mortem detection of fentanyl, their analogs, and sufentanil and alfentanil. Okay, so first let's start with the methods for drawing bodily fluids as well as tissue. Labeling, I have to emphasize because of the serious consequences can cause injustice. To collect tissue, you take liver, lung, scalp, body hair, finger and toenails, skin, subcutaneous tissue, and fat. Muscles are particularly useful in complete exsanguination or charring. You take bone and bone marrow. I put blood in tissue because technically it is a tissue, loose connective tissue, but for practical purposes, we'll consider blood to be a fluid. You draw blood from the vena femoralis and you place it into sodium fluoride for so the erythrocytes don't break down and release cellular contents. The same for vitreous humor. You can add sodium fluoride if you suspect alcohol poisoning. The hard blood is drawn from any chamber except if you suspect digoxin poisoning. Right or left ventricle is preferred. Bile, you take bile, you take all the bile, pericardial fluid if present, urine, vomit if present. Cerebrospinal fluid is best. It's tougher to take it through a spinal tap or suboccipital puncture, because if you open up the cranial cavity, there's a high risk of contamination of the cerebrospinal fluid with brain parenchyma, blood, lymph, toxins, bacteria, and such. So it should really be collected before the cranial cavity is opened, although in a patient with a normal brain, it is easiest to do a transcerebral aspiration of the ventricular cerebrospinal fluid. Contents of the small and large intestine. Mostly you're looking for plants and pills, which should be placed on cellulose for drying for later inspection. Stomach, generally you look for tablets, plants, but surprise is the name of the game with stomach contents. You can really find anything. Weigh all of it if it's homogeneous, and take the non-homogeneous substances out for inspection. Barbiturates are a bit tricky, and it remains a very troubling cases in determining accidental overdose versus homicide. There is some debate in the literature whether the barbiturate, the capsule coloring, can change the color of the internal layer of the stomach. So the stomach should be preserved. If you find a Tylenol in the stomach, it's probably not a Tylenol overdose because it has to be absorbed. So you would most likely find a bunch of it in the intestines, right? With barbiturates, it's a little bit different because depending on the formulation, capsule or tablet, there may not be traces in the small intestine, and a barbiturate pill within the stomach it does not mean that the patient did not die of a barbiturate overdose at all, because it could have simply been the last barbiturate taken that prior to the time of death. That's where toxicology becomes important for the barbiturate levels, as well as examining the large and small intestines for evidence of Fioricet tablets, maybe, but generally the stomach dissolves the pills for absorption, so you're really relying on toxicology of the fluid. Also, liver is important in barbiturate, as well as nerve agent poisoning. Practically speaking, you have to find nerve gases and volatiles at the scene of the crime using a gas syringe, but do take a lot of brain, lung, and liver tissue if nerve gas or volatiles are suspected. I don't think you need to place it in a cool container. Volatiles do explode, but if a patient was gagged with ether, it's gonna probably set on fire in the during the autopsy. But most volatiles, at least in the U.S., are not explosive at room temperature. In cases of complete putrefaction, maggots eat the body, and actually the deceased DNA is found in the maggots. Skull and teeth are very helpful to compare dental records, and the skull can give a better idea of the patient's known facial morphology. Bones can give also a similar is to paint the whole picture. If you have a giant femur and the victim is a petite female, well, obviously something doesn't make sense, right? If we knew that the deceased was 5'10" and you find a femur or a humerus that is much too large, then it doesn't make sense. So back to the fentanyl. Wipe suspicious skin parts off with cotton wool pad. Check the Merck manual always for opioid solubilities. But when we're talking about fentanyl, you can generally soak it with methanol. The goal here is to extract powder from the skin samples by dissolving it and heating and extracting the powder for laboratory analysis. Again, containers, this is obvious, but it should be labeled proper and sealed proper. It should have the forensic pathologist name, the assistant's name, date. All samples should have the same autopsy number. They should all have the same identification number, so all organs, tissue, and fluid is related to the case. And again, this is very important given serious implications of what is found on toxicology. It can, in a court of law, if there's a break, a chain in custody, it can cause very serious problems. Store the blood at 4 degrees Celsius, hair and nails at room temp, and all other tissue and organs generally negative 18 degrees Celsius. Again, they have to be locked and sealed. Again, for obvious reasons, because otherwise the evidence can be inadmissible in court, or if it does become admissible and was tampered with, injustice can be created. So methods for detecting fentanyl and fentanylogs. Fentanylogs cause the problems. So fentanyl is short-acting, except alfentanil, which is even more short-acting, and the metabolites only last 2 to 4 days. And the two major metabolites are norfentanyl and despropanylfentanyl. In the urine, norfentanyl can also be detected 2 to 4 days after use, which is great for forensic autopsies because the fentanyl will remain in the system, and you will be able to check for the metabolites. Now, in a medical case, if it was administered intrathecally or IV for sedation and anesthesia, that's a different story. But for forensic purposes, you can check the urine. Saliva samples are useless. The immunoassay approach is best for detecting the metabolites. The disadvantage is you have to know what you're looking for, which is where the fentanylogs become a problem, because unlike benzodiazepine analogs, which often have similar metabolites to their analog, is not so the case with opioids and fentanylogs. So, and these fentanylogs are new fentanyl analogs are being synthesized faster than law enforcement can keep up with. Gas chromatography, mass spectrometry is accurate. Benefit is you don't need to know what metabolite you're looking for. You just need to know how to analyze the results. The disadvantage is you need some pretty good equipment for 95% confidence interval that just because it's detected does not mean that it's present. It has to be above the cutoff level, which is a problem when the cutoff level is in the microgram range. However, the equipment today can detect above the microgram level. Liquid chromatography is similar to GCMS. Same disadvantage is the cutoff point, but in liquid, immunoassay approach is best if you know what metabolites you're looking for, and you will have a good confidence interval that it is present in the sample that you took the immunoassay from, unlike the gas chromatography and such. So times have changed. On the left is a morphine vial, on the right is a fentanyl vial. Very big difference in, as you can see, the morphine is dosed in milligrams and the fentanyl is dosed in micrograms. Fake Xanax laced with fentanyl deaths. Usually these are not intentional, but rather careless use of pill pressors, which will leave traces of fentanyl. And then Xanax pills are pressed and it introduces fentanyl by cross-contamination. So on the left, you see a real pill 2 milligram bar by Deva Pharmaceuticals. And now look, this is a fake S903. It could contain all Xanax. It could contain fluoprazolam or cross-contaminated with fentanyl or fentanylox. Now notice how even under the microscope, how good this pill presser is in town. You can hardly tell the difference. The only giveaway really pill examination is the number one standard, especially for street use to determine real or fake pill. But the script of this S is not the same script of this S. So this kind of throws you off a little bit, suggesting this may be fake. And it can be confirmed with laboratory methods, but you can see how even under the microscope it looks almost the same as the real Deva, but I mean, even Deva Pharmaceuticals has a little friability on the edges. All but that letter S there is a different script, which is the only giveaway really visually. So exercise, he sees a big bag of pills with imprints. The lowest first, you go to drugs.com, search for C8 pill imprint, and it will show you, it will be identified as 800 microgram buccal fentanyl tablet. It'll give you a lot of other important information in order to distinguish it from a pressed fentanyl pill. But of course, laboratory methods are the gold standard. And for users purchasing on the streets, the standard is visual inspection. It's really all you got, unless you have a gas chromatography machine yourself, or access to performing immunoassays, which most pill users don't tend to have access to. So pill hardness is not the same as pill friability. Unfortunately, fake pressed pills do tend to be more friable, as chalk is the only excipient used in friable tablets. Increase the dosage amount. Pharmaceutical companies use pill hardness to balance release of proper dose versus hardness for storage and transport to avoid pill breakdown. And that's it. Thank you for watching.